Have you ever felt abused, exploited, overworked, or taken advantage of? Do you find yourself simmering with resentment at those who don't appreciate all that you do? Do you feel responsible for keeping other people happy or calm, like something bad may happen if you don't? Are you ever trapped into doing something you don't want to because of what someone else wants? And here's the big one. Do you ever feel guilty when you even think about saying no? If any of this rings true for you, we need to have a talk about boundaries. A word we hear a lot that's still poorly understood. We're always told we need to set boundaries, but many people don't know how. And to understand how to set boundaries, we have to address the thinking process that's behind them. I'm psychotherapist Shavaun Scott, and on this channel, I respond to your questions on everything related to psychology, relationships, and mental health. If you enjoy this program, please like it and feel free to subscribe to my channel. It's easy to understand a physical boundary. When you see a fence or a wall, it's clear that it serves as a division between spaces. Someone owns one side and someone else owns the other. Fences come with the explicit understanding that what happens on your side is your business, and what happens on the other side is not your business. You take care of your business and you leave your neighbor alone. Psychological boundaries can be a little murkier to understand. When we talk about a psychological boundary, we're talking about the invisible, emotional, and cognitive lines that separate our sense of self and personal space, the lines between our thoughts, feelings, and identity, and others. These invisible lines, or limits, determine the quality of our relationships and our mental health. They help us differentiate our own thoughts, feelings, and needs from others. Let's look at some example of the ways boundaries show up. Physical boundaries pertain to our personal space and physical touch. For example, some people might be comfortable with hugging, while others prefer a handshake or maybe no touch at all. This encompasses sexual boundaries as well. We each get to decide what limits we're comfortable with. Emotional boundaries involve separating your emotions from someone else's. Emotional boundaries protect you from feeling responsible for someone else's feelings or letting someone else's emotions control your own. Setting an emotional boundary might mean not tolerating being yelled at, allowing yourself to be blamed for someone else's bad mood, or deciding how much personal information you share and with whom. Intellectual boundaries are about respecting and protecting your thoughts, ideas, and beliefs. It means not allowing others to manipulate or control you, and it involves being able to say no to ideas that are not aligned with your values. Disagreeing respectfully with others is an example of keeping good intellectual boundaries. Time boundaries involve setting limits on how you allocate your time and energy. This is particularly relevant in the areas of self-care, work, family, and other commitments. Material boundaries refer to your possessions and resources. It involves deciding what you're comfortable sharing or giving to others and what you need to keep for yourself. You get to decide these things. This is what setting boundaries means. When these boundaries are clear, well-defined, and respected, we can communicate effectively, protect our mental health, and have a sense of control over our lives. The ability to set good boundaries develops in childhood, but most of us didn't grow up in families where we were taught to do this, so it doesn't come naturally. People often don't understand that they have the right to set limits, and this is where the thinking process comes in. Without a clear sense of what our boundaries are, we can't communicate them to others, and this process has to start with self-awareness and reflecting on what is and is not acceptable to us. Sometimes when we do this, we run into beliefs that are keeping us from setting good boundaries, and we can call some of these beliefs people-pleasing. People-pleasing beliefs are common and are often at the core of poor boundaries, but they operate beneath our level of conscious awareness. They're automatic thoughts. This is the pattern of striving to please others while sacrificing our own needs. People pleasers learned as children that they would only be loved if they were nice and compliant, and if they didn't have boundaries. In many homes where there was harsh physical or emotional punishment, people pleasers learned that they had to keep others happy just to stay safe or to be loved. People who grew up in this type of home learn to constantly monitor the moods of others around them, and they feel anxious if they sense that others are tense or unhappy. This tendency can be viewed as a trauma response, which may have helped a young child feel safe with an angry parent, but it prevents that person from developing skills in setting boundaries as they grow into adulthood. Because people pleasers have weak boundaries, they're typically used or even abused by others in their workplaces, families, and in friendships. And this leads them to be constantly resentful, anxious, and depressed. It's not a strategy that works well because it's based on beliefs that were developed from growing up in a toxic family. And these beliefs no longer apply to the present-day reality, but the thoughts that underlie people-pleasing happen automatically. Here are some of the most common ones. If I say no, I'll be punished or rejected. I'm only loved if I'm compliant and giving. If I don't do what someone else wants, I'm being selfish and should feel guilty. I monitor the moods of those around me to stay safe, and I'm responsible for keeping them happy, because if they're unhappy, I feel that I'm in danger or that something terrible may happen. If we want to learn to set healthy boundaries, we need to understand these underlying mistaken beliefs and automatic thoughts, because with awareness, these beliefs can be changed. They may have made sense when we were children, but we don't have to carry them into adulthood. Boundaries are not just behaviors that we do, though they can be. They're based in the ways we think, so they happen in our heads. Often boundaries are the things we don't do, because simply declining to engage in other people's dramas or to step away from power struggle are ways of keeping healthy boundaries. It's often what we choose not to do. A statement I like is, I drive in my own lane and I'll stay out of yours. Clarifying our boundaries is an important way of taking responsibility for our own lives. We can see that we're improving when we notice that we choose where to put our emotional energy and where to put our time. We choose who we want to get close to, prioritize spending time with people we enjoy, and we see that our relationships are reciprocal. When we realize that others' emotions belong to them and it's not our responsibility to keep them happy or calm. And when we see that others' choices belong to them and we can step back out of the position of trying to fix or control them. You are in charge of your thoughts and your choices. Boundaries protect us and are key to living a peaceful life. If we don't set them, no one else will. Having boundaries improves our relationships and our mood because then we don't go around feeling resentful. When other people understand what our boundaries are, they're less apt to violate them. If we don't make them clear, we can't expect that they'll be respected. This is an important part of taking power over your own life and destiny. In summation, this takes self-awareness. Reflect on your own needs, values, and limits, and notice if you still entertain people-pleasing beliefs that are getting in your way. Identify what boundaries you need to set in various areas of your life and communicate your boundaries openly to others. You can use I statements like, I feel overwhelmed when I have too many commitments, so I'm unable to offer you childcare that day. Practice saying no and rehearsing in advance, and seek support if you need help. You can always talk to a trusted friend or maybe a therapist. Celebrate your progress every time you successfully stand up for yourself. Setting and maintaining boundaries, it's an ongoing process. It gets easier with time and practice. Be patient with yourself as you learn to prioritize your own well-being. Take good care.